Hi, everybody. My name is Dennis Dicker, the founder of Amity Cloud, a mobile communications training and management platform covering the entire spectrum of home healthcare. I'm a serial entrepreneur, a computer engineer. I like things done and done right. My career started off in real estate and then at the patent office working as a patent examiner for the USPTO. And I was able to start a Medicaid home health agency where we've tested Amity Cloud the past 3 years, and we've documented more than 30 hours of care. We've grown to more than 50 staff and more than $1.6 million last year. But running a home health agency is very difficult. It's complex and expensive. And in fact, the traditional methods are just not working. You have to hire, you have to train based on state regulations. You have to train them again based on the individual support plan. And then you have to do payroll. You have to manage the home based on state regulations. And then you have to document everything to make sure you can bill on time. And if anything goes wrong during that process, you're paying somebody overtime. And it's costing the industry more than $6.6 billion a year. Let me tell you how Amity Cloud streamlines the entire process, saving providers thousands of dollars. Meet John, a 28-year-old male with autism spectrum disorder. He requires 24-hour supervision and more than 5 staff to help him reach his goals of independent living. With Amity Cloud, we provide free training to the general public. We have a chat application similar to WhatsApp, Slack, or Snapchat, so that everyone can use it. Then we offer free trainings for everyone. For small businesses, home health providers, or third parties, they can use this application for field service for $10 per staff member. And then they can use our beacon technology to help manage the staff while in the field. I'll talk to you more about the beacon technology, but it's being used currently in the retail industry to monitor consumer behavior and provide products at a discount rate. Our free trainings are on a patented adaptive learning technology platform, and these are based on state regulations, which are different for each state. Our beacon technology provides a quality assurance for staff and additional HIPAA compliance, so that only certain information is noted to each person based on their GPS location and location within the home. I'll tell you more about that later. But back to John. This is a typical day for John. But what if there's a repair issue that's needed in the home and he needs to get to his appointment on time? With Amity Cloud, everybody's on the platform, even the repairman. So the caregiver can document what's wrong in the home, the repairman will be able to see that, and also the agency provider will be able to see that. And if there's a supply that's needed, the agency provider will be able to transfer funds onto the debit card that the repairman has to purchase needed supplies and fix the problem as soon as possible. If John needs to get to his appointment, his caregiver can communicate directly with the transportation provider and also the doctor ahead of time to give them updates of what's going on. And when there's time to give medications, if the caregiver forgets to administer meds, Amity Cloud would be able to give a notification to the caregiver to go to the specific area inside the home to administer medications. While our competitors are focusing on part of the problem, we're providing a complete solution that's scalable, and it's saving providers up to 95% compared to traditional methods. We have an online magazine. We're reaching more than 100,000 Instagram users through our different accounts. We have access to a database of over 17,000 home health providers, and our sales lead is also a certified investigator in 15 states. And he's able to demonstrate using Amity Cloud how providers are able to reduce allegations of abuse and neglect with our system. We currently have 10 providers on the platform and 300 users and 70 homes. And by Q1 2017, we'll have 2,500 users, 25 providers, and over 500 homes. And we're looking for partners to help us scale into other states. Our goal is to help John and many others to be more independent and use a platform that's easy to use and scalable. Thank you.